thank you very much for joining. I'm going to give you a brief overview first, in case this is a new project to you, and then I'll introduce the toolkit and how we're planning for it to be used. So you may already know about our organisation, but for those of you that don't, so Doctors of the World UK branch is part of Médecins du Monde, the international network, and our aim is evidence-based advocacy. So we try our best to empower excluded people and communities to claim their right to health. So this is kind of a two-prong approach, by providing services, but also by advocating for rights. And when we talk about excluded groups, we generally mean people who are refugees, asylum seekers, people experiencing homelessness, sex workers, people from the GRT community. So this toolkit was produced really primarily for our excluded populations, but we know that it may be used wider, and we're happy for that to be the case. So I always come back to this quote whenever I do a presentation, because it's the reason why we're doing this kind of work, because we think that everyone has the right to make an informed decision about everything really, and in this case about taking the COVID-19 vaccine. And this was a quote from one of the sessions I did a couple of months back, where we asked for questions beforehand, and somebody said, to be honest, I don't know what to say about the vaccine, because some people say it's good and some people say it's bad. I'm so confused. So what we're trying to do is address some of this confusion. So today, what we're going to cover is a bit of a background into the scoping exercise that we conducted. So I'll go into more detail about what that is, and then how to conduct your vaccine confidence session if that's something that you'd like to lead within your organisation. We will introduce the Doctors of the World Vaccine Confidence Toolkit. I'll give some brief tips on how to talk about COVID-19 vaccination, which may be something that many of you are already aware of how to do, but we think it's important to have this kind of resource as well. Then my colleagues Claire and Matteo will run through the slide set that we have. So again, this will make more sense when I run through the presentation. If I can ask, please, if you're able to mute yourself if you've joined, that would be great. Then we will discuss the toolkit and how we would like to progress with the toolkit, and how we'd like to develop it further. And this is where I'd like to invite you to participate and to help us with this. We'd be really grateful for that. We'll have some time at the end for feedback from all of you, because this is a very new toolkit. So we'd love to hear both positive, negative, neutral feedback, and for you to ask questions on its use, or some general questions around vaccine confidence. So we're hoping this will last around about 1 hour. So we've got about 50 minutes left. Right. So what's already out there in terms of information? There's a lot out there. So actually trying to produce more information here, it's so important that we produce what's useful and what's needed. And in all our work looking into what's available out there, there is that word, it's confusion. There's a lot out there, so it's hard to know what to pick, what to trust. And that's hard as a medical professional. So as a member of the public, sometimes it can be an overwhelming amount of information. So the brief that we were given by NHS England was to produce some impactful assets for improving vaccine confidence in excluded populations within the UK. And my team is myself, Claire, Matteo, and also Amy, who is not here with us today, but has been a vital part of informing the toolkit. Amy, who's a public health doctor. And what we decided is that we need to know what the evidence really indicates is the best practice in building vaccine confidence. So what's really shown to be useful and effective in improving confidence. And vaccine confidence may or may not be a new term for you, but we think it's quite important to reframe vaccine hesitancy as confidence. So putting the onus back on us to build confidence instead of labeling people as hesitant. So that's why we use this word a lot. So we decided actually to start off with a scoping exercise to see what the need was and what we could do best to improve vaccine confidence. So we started with a brief literature review and a review of the current best practice. So we had a lot of support from Dr. Sally Hargreaves and her team. And I think we may have some from her team today. I think Alison's here. So we were really grateful that they produced a grid of the evidence that gave us a good solid foundation to produce this toolkit. We also ran some surveys, both organizational and individual. So we captured quite a large group of people representing various organizations who support refugees, asylum seekers, Gypsy Roma traveller community, people experiencing homelessness. Many different organisations contributed, so we're really grateful for that. And we also sent out the survey to individuals in those communities as well, to ask them, you know, what is it that makes them feel uncertain about the vaccine? Do they have questions? Where are their trusted sources? So this was a big question. Who do you trust with information, with giving you information? We also ran some interviews and some focus groups, and Amy's organisation, Bevan, was really instrumental in that. So that gave us some more in-depth information about this as well. And just a very brief overview of the barriers to accessing vaccines. And this is the WHO 3 Cs, so confidence, complacency, and convenience. So you can see more information about each of those. Generally, confidence boils down to trust. Do we trust what's in the vaccine? Do we trust how it's delivered? Do we trust the people delivering it? Complacency can be summarized in, you know, what do you think you're at risk? What's your general view of COVID-19? Maybe you think you're young, maybe you think that you've had it already, maybe you just don't think you really need it. Convenience means a lot more than that. It can encompass digital exclusion. It can encompass difficulty actually physically getting to the vaccination site. It can involve difficulties with GP registration, which is a big part of the work that doctors of the world do, trying to empower people to be registered with GPs and promote that. And then also a big issue, which is the fear of data sharing. So you may have joined our previous sessions helping to brainstorm what we would do about the results of our scoping. So the scoping showed that basically there was a lot of distrust. There's a lot of detail, and I'm happy to share some more details of our scoping if you would like, because it did give us some valuable information. It also did tell us probably what we knew already about the distrust, but it gave us a breakdown into why and who was trusted. So what came back is people trust people that they know, people that look like them, that sound like them, people within their communities. They may trust their GP, they may trust their pharmacist, usually their local GP, their local pharmacist, or a community leader, or someone that doesn't necessarily have that formal title of leader, but is considered a leader within the community. And someone mentioned something at one of our last sessions that I thought was great, that the person within their community that was trusted was actually the local butcher, and a lot of people would pop by and ask him questions about the vaccine because he had read up a bit more about it, he'd taken it, they'd ask what his experiences were. So it can be anyone that has a desire to promote this in their communities, backed by knowledge and by quite readily available knowledge, but in the right kind of format. So we've decided to make a toolkit that will allow people within the community to empower their own communities with vaccine confidence. So just to briefly run through how we'd recommend you conduct your session. And this is based on some of the sessions that we conducted before we produced this toolkit. So firstly, identify within your organization or within your population, is there a need or has there been a request for information? And often you may notice that people ask you day to day kind of, oh, I've heard about the vaccine. What do you think? Do you know what's inside it? I've heard that this and this happens. Maybe it can, you know, it has a chip inside, or I've heard that it has fetal material. There can be many different things. So if you hear those kind of things floating around, then maybe there is a need. So identify that need. Then start to gather questions and concerns from your population. So we found this was really, really important to allow people the opportunity and to encourage questions and concerns throughout the whole process. So not just at one point in this. We think that before, like gathering those questions can give you an idea of how to direct this session, because we have a lot of resources, but you don't need to use all of them. You can use the ones that are best for your group. So maybe formally you could send out an email, or if it's face-to-face, you can ask for the questions to be written down, and keep those there. And you will need to do some preparation. So look through the resources that we have and try to identify what matches what you need. Next, we advise you, because this is this does contain medical information, it's important that it's accurate. So we will keep our slides up to date. So they will, and they will have a last review date. So you know it's accurate as of this date. But we advise you to invite trusted healthcare professionals from your area. And we've produced a template letter for you to send to GPs that can say GPs, pharmacists, nurses, any healthcare professional, to say, would you be able to join our session? And I think it's quite powerful if they're from the local area. Some of your participants might even know them, and it builds up connections, which is really an important part of this. Then invite your audience. So try and do that with, we think maybe like a week or two in advance might be great, and even before. But often you get a lot of participants in the few weeks just before the event. You may do this by email, you might need to do it by letter, face-to-face. If you have a face-to-face area where you see your service users, then try to put up posters, try to find multiple ways of inviting your audience, so that we address some issues such as digital exclusion. Then conduct your session. So like I said, with question and answer, try and allow different people different ways of asking questions. So you may have the chat box, you may allow people to unmute, you may have another kind of face-to-face way of doing this. You may want to record your session for people that couldn't attend, and you may be able to play it in a face-to-face scenario as well. And then afterwards, it doesn't finish. You do want to still allow feedback and opportunities for follow-up. And maybe somebody did go along to a vaccination centre and get their vaccine. So you may want to promote that and have maybe a follow-up session as well to say, how did you find the vaccine? Is there anything else you'd like to ask? Because remember also that most vaccines require 2 doses. So it's very, very important that we maintain that confidence for the second dose as well. And along the side, I've written, throughout all of this, have an open, non-judgmental space, because that really is, it's kind of what's our right anyway to make our own decisions, but also it does help promote confidence and trust. So now an introduction to the toolkit itself. The primary part of the toolkit is a slide set and accompanying slide notes. And that is just entitled COVID-19 and Vaccination. And that's what we'll run through quite briefly. And the slide notes, they have speaker notes, and they also have signposting for further information. So if you'd like to read up more about that specific topic covered in the slide. We have a couple of infographics, one that's ready, which is talking about the vaccine. So tips on how to communicate, because it's not just what we're saying, it's definitely how we're saying it. And then we have an animation about how to register with a GP and then get the vaccine, although that's not the only route. We think it's a very important route to getting the vaccine. We have frequently asked questions for organizations and frequently asked questions for individuals. And this also includes videos that we've produced. We are in the process of producing more videos, subtitling them, getting them translated. So watch this space, because there is a lot more to come as well. I've put the link in there. I think what Claire will do when she runs through the slides is take us to the link and show you how to access this. So at the moment, it's just the slide set and the slide notes that are up there, but within this week and next, we'll be adding a lot more. So please do watch this space. And we're hoping in the next few weeks also to have the slide set translated into 5 languages. And depending on further funding, we may be able to translate into more languages. So very briefly now, this is running through our infographic, which is talking about the vaccine. I've just screenshotted parts of it. So in terms of talking about the vaccine, this may all sound very, very straightforward and very obvious. And if that's the case, then I'm really, really pleased about that. If I'm honest, even in doing this, I started to think about how I talk to people about the vaccine, and I do it professionally day to day, and I feel like I'm okay with that. But personally, I have members of my family who are very much not happy to take the vaccine and haven't yet. And this has really changed how I've personally talked to people about the vaccine. So firstly, being empathetic, just acknowledging that it's very, very normal to have concerns and questions, especially about anything new. There's nothing wrong with that. And that's the basis that we start on. So having a non-judgmental space, allowing time and space, acknowledging that people might feel a certain way about it, and then really showing that you're listening. Then exploring what matters to that person. Again, listening. If it's relevant, share what your experience has been. And people tend to like stories, and they want to hear from individuals that they trust, as we said. Empower people to make their own decisions and to make an informed decision, and respect their right to choose. Try not to label people as anti-vaxxers or dismiss their concerns, because often that turns people away from you quite immediately. And then inform people. So ask for permission to share resources. Kind of, would you like some more information? And often people will say, yeah, sure, I'd like to read more about it. If they don't, then respect that as well, because they may come back to you after they've thought about it. See how the person feels now after you've talked about it. And then if they do want the vaccine, support them to access it, because as we talked about, access is quite an issue as well. So this is just a screenshot of the summary page of the slide set. It runs through 5 sections about COVID-19 itself, about vaccination, how to access the vaccine, generally what we can expect next, and then time for question and answers. And then you see on the right a screenshot of the slide, speaker notes and further information. So now I'll hand over to Claire, who will talk you through briefly some of the slides.
Thank you, Fatima. I will share my screen. Is this visible? Yes. So we've worked hard on these translated materials, and as Fatima said, watch this space, because there's more to come. So if you go to the general website of Doctors of the World and you click what we do, and you go to translated health information, you will end up getting the toolkit information at the moment. And you can also just select it if the layout looks a little bit different. So when you then come to the Vaccine Confidence Toolkit, at the moment there's 2 documents that I will talk you through. The slide set, which is the backbone of the toolkit at the moment, and the speaker notes that go along with it. So I have them here, the slide set and the speaker notes. So prior to using our toolkit, I would highly recommend you look at all the resources in the toolkit, so you can pick what you think is most appropriate and most useful for your session with your audience. The speaker notes will help you to talk through the slides, and they will give you a little bit more background information. More detailed information, if people have questions about the information you're providing, is provided in the individual FAQs or the organizational FAQs. So again, you might want to look that through. Having a clinician on board supporting your session might make it easier to answer questions as they come. Otherwise, you can always get back to any question asked that is more difficult to answer instantaneously. So if you go to the slide set, let me make this a little bit smaller. COVID-19 and vaccination. So the slide set is not to convince people or tell people what to do. It's purely informative. And it talks through the disease, and it talks you through the vaccination. So you've seen this. I will talk about the first 2 sections, followed by we'll talk about accessing the vaccine. Section 1, it's about the disease. It's about the symptoms to look out for. It's about informing people on how it spreads. Then talk about the risk, what makes me more vulnerable to the disease, what makes the people around me more vulnerable to disease, how does it spread in the society? What are they reporting about? And what are potential consequences of the disease? Apart from the severity, can I, develop complications due to the disease? So there were in our scoping exercise and presentations with different groups, a lot of questions about the long COVID. So again, informative slide to talk through. About the testing, what is the difference between the tests? When do I need to do what and why? Then about variance, I think there's a lot of talk about variance. A lot of government regulations are based on variants that arise. So I think it's useful to give people some kind of knowledge about it. What are they talking about? What does it mean? And then what can you do? What can you do to protect yourself? What can you do to protect the people around you? How do you reduce the spread? And also why? What's the consequence? Why do I need to physically distance? Why do I need to wear a mask? So this all backs up with literature. Then if you want, you can allow some space for questions to be asked, but that will be up to you to see what is most appropriate for your session. And then about the vaccination. What is vaccination? Why do I need vaccination? How does it work? There's a lot of unknowns about vaccines overall, vaccines at later age, and vaccines for new diseases. So this gives you some information about what does it do in my body. A lot of questions from people are how come that they made this vaccine to work? So that's important to address. Again, the speaker notes will give you a lot of ready-to-go information to talk through the slides. What are the ingredients of the vaccine? Again, to address some concerns about microchips, magnetism, etc., and be very clear about what is in there. Now, what is currently being offered in the UK? How does it work? What's the efficacy? How many shots will I need? Is it safe? Is there any risk connected to the vaccine? Can I have it if I have a special situation? Does it influence my pregnancy? Does it influence my fertility? Can I get it when I'm breastfeeding? What is the consequence for my child? And then very practically, how does it work? What will they do to me? And what happens to me after I get the vaccine? So nearly every vaccine has side effects, but it's just very important that people are aware that these are expected side effects, but also for people to understand that if it's more serious than expected, to get help. And be very clear about it. This is ongoing information, so we'll try to keep the presentation as up to date as possible. And then what are the regular intervals and what is the proof they're providing me? So initially it was these paper cards. Now there is an NHS app where you can download your QR code, and you can also order certificates. And again, allow ample time for people to ask questions. Yeah, the more you do it, the more you get accustomed with the speaker notes and the FAQs, the easier you will find it to answer questions from your audience. The next session is about, okay, if I have all this knowledge, if I want to have a vaccine, how do I get it? So I will hand over to my colleague, Matteo, who will discuss the access to COVID-19 vaccination in the UK with you.
Thanks, Claire. Just give me 1 sec to share my screen. Can you see now the?
Perfect.
Okay. So, sorry about that. So as I was saying, this section of the presentation talk about the access to the COVID-19 vaccines, because we knew from the scoping exercise and also from our work, from our day-to-day work, that a lot of the problems related to the COVID-19 kind of vaccine confidence was actually related to access to the COVID-19 vaccine and the fears that people have in accessing mainstream healthcare. So the idea of this part of the presentation is really to reassure people in terms of their entitlement, data sharing in primary care, and also kind of to make a difference between primary and secondary care. So in terms of the entitlement, we know how everybody is entitled to kind of test, treatment, and vaccination, and there are no immigration checks done at the point of administration of the vaccine and so forth. And here the presentation makes clear how there is no need to have an NHS number, a home address, or be registered with a GP to receive a vaccine. But we know all those elements are important for a mainstream access to healthcare. Otherwise, people have to rely on pop-up vaccination clinic. This slide really emphasizes again how everyone is entitled to register with a GP, is free to register, and now you don't need proof of address or immigration status or ID or NHS number to be able to receive the vaccine. And again, we specify how people will not be charged for testing, treatment, and vaccination. We also briefly talked about the GP access card, which were introduced last year by NHS England, and really want to help people kind of advocate for their right to be registered with a GP. And also we have our helpline phone number that people can call if they are struggling to register with a GP. And I'm gonna briefly show the animation. It's 3 minutes, so we should still be on time with the Q&A section, but I think it's good if you can have a look at this as well. Okay. Can you hear me?
Yes.
Okay. Just loading the video. It does load. Yeah. Hello and welcome to the Vaccine Confidence Toolkit. My name is Fatima Sheikh. I'm a GP who works in... So let me skip to... Could you hear the noise in that? The sound?
Yes.
Okay. So let's see if we can just skip to one of the questions so you have kind of the structure. So Claire, does everyone develop symptoms who's infected with COVID-19?
No, about 1 in 3 people infected with COVID actually don't develop symptoms, but they can still transmit the infection to other people who may be more vulnerable than themselves and who end up developing symptoms from mild disease to severe disease and possibly end up in hospital. This is why it's so important then, if you're told or you know you have been in contact with somebody who has COVID, to self-isolate and regularly test with the rapid tests that are readily available now. These are the lateral flow devices. You use them when you actually don't have symptoms, and you can use them yourself. You can do it at home with following the instructions. Now, when you do develop symptoms, it's really important that you order a PCR test, either for a test to be delivered at home or via a testing center close to where you reside.
And then I'll play the next one as well, just so that you are aware.
Fatima, there's a lot of talk about long COVID, and people want to know, what is it? Could you tell us a little bit about it?
Yeah, so long COVID is actually currently recognised as a possible chronic complication of COVID-19 disease. And we don't really know how many people go on to develop this yet. But if you are generally having symptoms that last after 12 weeks, that persist beyond 12 weeks of having COVID-19 infection, then this may be long COVID. So some people may suffer from symptoms such as ongoing breathlessness or ongoing tiredness, fatigue, or something called brain fog, that kind of inability to concentrate or focus. And if you are experiencing these symptoms, we'd recommend that you contact your healthcare provider, so your GP usually. Okay, so as you can see, hopefully different ways of showing information. So there's slides, there's videos, and there's that most important thing, which is talking to your service users. I will just share my screen to get back to that presentation again. Finally, just to wrap up, what we would like support with actually with our toolkit, as it's all very new, we want to have this as a process where we do develop, where we do improve it, where we take on feedback. So we'd find it incredibly useful actually if you're able to participate, if you do decide to use this toolkit, if you're able to participate in our pilot. And we have surveys available. So we have a pre-session survey and a post-session survey for your audience. So this is also useful for your own understanding of whether the information you've provided has been useful and kind of reach the audience in helping them feel more informed, and then hopefully helping access to the vaccine as well. So it asks people how they feel about vaccination before, if they've had issues with it, and then afterwards how they feel after having had that information. There's also a separate survey, which is an organizational survey for feedback, and that's from you, that we'd like to hear how you felt about delivering that toolkit, whether you would like to see different things added, whether you'd like to see things changed and how we portrayed them. So if you are interested, please do let us know, and we can share the links to these surveys, and hopefully they will also be on the website shortly. So that's everything from all of us today. So now it's just time for you to ask any questions, give us any feedback, anything that you'd like to say, please feel free to write in the chat box or to raise your hand and we can let you speak. Thank you very much. Thank you. And if you would like to contact us, you can contact, I think in the first instance, Matteo, so mbasana@doctorsoftheworld.org.uk. Thank you. I think that we can stop recording now so that the question and answers don't need to be recorded. Thanks, Matteo.